Hi everyone, this is Dr. Geronimo again, coming to you from San Diego BrainCenter.com. Actually, the website is sdbraincenter.com. Um, I created this video to basically expand on what I did in the earlier video, the 5-minute video that talks about brain fog, chronic fatigue, and mood swings. Um, that was basically the center topic here, but what I want to illustrate is that every one of these topics here, or subtopics, can be in the middle of this little web that we have here. So it's all interchangeable. So we're going to focus this one on autoimmunity. Autoimmune issues are the most common complaints that I see, or patient that I see. Most likely Hashimoto's, rheumatoid arthritis, celiac disease, MS, lupus. There's hundreds of autoimmune diseases, but the main issues that they have, or what they have in common, is that they have brain fog, chronic fatigue, and depression. And we've talked a little bit about that with respect to the brain, but this is what I do, or kind of my checklist, so to speak, to how to address the autoimmune patient. So the very first thing that we have to look for is the GI tract, and we have to rule out signs of inflammation in the GI tract that can flare up autoimmunity. Okay, basically that's what we're doing with all of these subtopics, is we're ruling out signs of triggers of inflammation, and we're trying to basically modulate or minimize those inflammatory triggers as much as possible to minimize the autoimmune attacks that you're having against your own body. Okay, so with the GI tract, what we need to do is we need to rule out gut infections. Now, gut infections can be anything from parasites, fungal infections, to dysbiosis. When you have dysbiosis, you usually have what's called SIBO, which is small intestinal bacterial overgrowth. And when you have SIBO, that's usually due to a faulty vagus nerve, or an inactive vagus nerve, which is a nerve that comes from the brain. It actually comes from the brain stem, and it is the main parasympathetic nerve. Its main actions are to increase motility to the gut, which means that it gets the food moving along the GI tract. It also produces the enzymes for digestion and absorption. And so without that proper vagus nerve, you don't have proper closure of certain valves in the gut. And with this one in particular, it's called the ileocecal valve. And if that valve stays open, the bacteria from the large intestine migrates into the small intestine, and therefore it's called small intestinal bacterial overgrowth. And so to really correct that, you have to correct what's going on with the vagus nerve. And that, in order to do that, we need to figure out what's going on in the brain. Okay, now there's definitely protocols and there's definitely supplements that we can do to eradicate SIBO, but in order to keep that from reinfecting or reinoculating you at some time down the road, we really need to improve vagal nerve function. Okay, then everyone with an autoimmune disease is also going to have a leaky gut, and with the leaky gut, you're going to have food sensitivities. So we really need to look at food sensitivities. Usually, for most people, going either paleo or autoimmune, paleo is sufficient to minimize inflammatory triggers. But if that's not good enough, we have to explore, FODMAPs, oxalates, low histamine diets, and maybe we have to really look at food oral intolerance, or basically just oral intolerance, meaning that you're just not digesting your food properly. And if that's the case, we need to really work on digestion and absorption to minimize the triggers that activate the leaky gut and therefore activating autoimmunity. Okay, obviously we have to look at the brain. Okay, with the brain, the brain needs three things to basically function properly. It needs glucose or ketones, it needs stimulation, so some type of exercise, and it needs oxygen. Okay, now your brain is not going to get optimal oxygen levels if your adrenals aren't working properly, meaning if your blood sugar is not regulated, or if your blood sugar is not high enough, if you tend to have low blood sugar, then you're not going to get optimal blood flow to the brain. Okay, it's not going to get to oxygen if you're, let's say you're anemic. Okay, if you're anemic and you don't have enough iron to make red blood cells, then you're not going to get enough oxygen again into the brain, and so that can create inflammatory responses. If you don't have any stimulation, meaning that you're just a vegetable, you're at home, you don't do much, you don't have the energy to do much, you barely get out of your house, you're basically in this vicious cycle where you don't get any stimulation, therefore your brain just gets more inflamed and inflamed, and you get more fatigued, and you're just in this positive feedback loop where there is no end. Okay, so in order to really treat the brain, we need to get you out, we need to get you exercising, and if you can only walk for 30 seconds outside of your house, do that, and then maybe tomorrow you can walk for a full minute, and then build from there, and maybe by the end of 2 months you can walk around your entire block, and then you can maybe build up to jogging. But these are things that are going to come with time, but you really need to will yourself to do that, because that's really the only way to get stimulation to your brain. Other things that you can do, you can do crossword puzzles, you can stimulate your brain cognitively, you can do, play a musical instrument, or even learn to play a new musical instrument. You can learn a new dance, you can learn a new sport. Anything that's going to involve learning is going to stimulate the brain, okay? As far as glucose or ketones are concerned, obviously this has to deal with blood sugar. So, you need to get your blood sugar regulated. You need to get your insulin levels regulated. I'll talk more about that when we hit blood sugar. And even if you are, if you tend to be a little bit more pre-diabetic or insulin resistant, it might benefit you to maybe go on a fast once a week to build up ketone levels, because research is showing us that your brain may function better on ketones when it's trying to heal. So that's something that I would recommend. But I wouldn't recommend doing this on your own. You really need to be under your doctor's supervision to really do this ketosis properly. With that said, I'm reminded about the disclaimer that I failed to mention earlier in the video. This is obviously not intended to treat or diagnose or to manage any conditions that you may have. Please, always refer to your medical doctor or your primary care physician with respect to your medications, okay? These are just functional medicine and functional neurology options that we provide for our patients here, okay? Back to the brain. With respect to the brain, another trigger that can activate inflammatory signals to increase autoimmunity are what's called neurotransmitters, or an imbalance in neurotransmitters. Now, the neurotransmitters basically determine our personalities. It determines whether or not we're happy. It determines whether or not we're sad. It determines if we have motivation, if we have passion, if we have, the intelligence that we need. Everything is basically judged or governed by these neurochemicals in our brain, okay? And there's many more neurotransmitters than I listed here, okay? But these are the main big ones. You've probably heard of serotonin and dopamine. These are your feel-good neurotransmitters. You've probably heard of acetylcholine and catecholamines. This is what's needed for, proper memory recall, whether it's visual or verbal. Catecholamines is basically the speed of our thoughts. If we're too slow, or we just don't have enough energy, then we're probably lacking in catecholamines. And then GABA is the main neuroinhibitory signal. So that really is a signal that inhibits our primitive brain, which has to deal with our emotions, our impulses, our sexual desires. That's all gated by GABA. And, if GABA is not there, as a result of maybe a GAD, or what's called GAD antibody, which, is basically turned off in the presence of gluten. If you have a gluten sensitivity, you can have less GABA, and therefore you can be a little bit more reactive, you can be a little bit more impulsive, your behavior is unchecked. This is really what we see with kids with ADD, or even adults with ADD or ADHD. Getting them on a gluten-free diet helps with that GAD enzyme to make even more GABA, and that helps with their symptoms. Okay, there's other things that we need to do, obviously, with the brain in terms of decreasing the neuroexcitotoxins, which are mainly glutamate and aspartate. Okay, you probably heard of glutamate as in MSG, monosodium glutamate, or aspartate as aspartic acid or aspartame. This is commonly found in sugar sweeteners or sugar substitutes. Most likely, or Equal has this. Okay, so what these do is they attach to what's called NMDA, or they activate NMDA receptors, which causes the influx of calcium and sodium and all these positive ions into the cell, and eventually that cell bursts and basically dies. So that's not something that you want, obviously, but these are things that you need to avoid when you're really managing issues with the brain. We already talked about CBC, which is a complete blood count. We need to make sure that your red blood cells, your hematocrit, and your hemoglobin levels are up to par. That way you're not anemic, or even maybe polycythemia, which is having too much of this, and you can have too thick of a blood, but that's a little bit less common than anemia. Anemia is what we see very common, and anemia, again, is one of those biggest deal breakers of them all. If we can't fix the anemia, we can't really fix anything else, because anemia is how every cell in our body gets thyroid hormones. It's how every cell gets insulin, oxygen, nutrients, whatever. Everything is carried by red blood cells, and if we're not getting those nutrients to other tissues, then those tissues just simply won't heal. Okay, white blood cells. This is part of our immune system, and there's lots of things that can affect white blood cell. An infection obviously is going to elevate white blood cells, or maybe an autoimmunity can result in what's called immune dysregulation and a decrease in white blood cells. So we definitely have to look at that and address the immune system, which I'll talk about a little bit more down here. Okay, but you're starting to see how everything is kind of connected to each other, and that's why you can really interchange all of these topics and put them in the middle. And therefore, if you have like a blood sugar issue, that blood sugar issue can be in the middle, and if you can treat that, you can help improve the brain, you can help improve the adrenals and thyroid, the liver. So everything is connected. That's the whole point of this video, and that's really what I wanted you to kind of get or gather as the main topics here. Okay. Now again, with blood sugar, you can either be hypoglycemia, where you're low on blood sugar all day long, and so you tend to crave sweets all day long. You might feel a little bit energized after you eat, or you might even feel agitated, easily angered, or just irritated if you miss a meal. Okay, those are all symptoms of hypoglycemia. You might also be about 5 to 10 pounds under your the weight that you need to be. And again, that's because you're just not eating enough. Hypoglycemics don't get the signal to eat to their brain. So what I do with my hypoglycemic patients is I have them set an alarm, every 2 to 3 hours or so, just to remind them to eat. And that's, if that's something that you have to do, you've got to do that. Okay. The issue with insulin resistance is there's basically, the insulin can't bind to insulin receptors, and therefore glucose can't be converted into energy in the form of ATP. And if that's the case, if glucose can't go through that metabolic pathway, it is then basically converted into fat. Okay, I know that might have sounded a little technical, but when you have insulin resistance, you're usually about 10 to 20 pounds over your weight. You might have a harder time losing weight compared to people who are hypoglycemic. It might take you a little bit more of a drastic exercise routine, or maybe a change in your diet completely to lose that weight. And then also you fatigue, or you have that food coma after you eat, and that's really what you want to avoid. The only thing that should change when you eat is that you're no longer hungry. Okay? There should be no energy changes. There should be no highs or lows in terms of energy throughout the day, and that's when you know that your blood sugar is stable. Okay? So Whenever we're talking about blood sugar, we also have to mention adrenals because they go hand in hand. Okay, insulin for blood sugar, cortisol for the adrenals, and usually, if you're hypoglycemic, you're really, you've got hypocortisol levels or not enough cortisol levels, and if that's the case, your energy level fluctuates throughout the day. You might have problems going to sleep. It may take you maybe a whole hour just to lay in bed. Some patients take longer to really fall asleep, and your sleep is just really not that restful at night. You may wake up even more tired in the morning, and then that just drags along throughout the day. Okay, those are all symptoms of hypoadrenal dysfunction. Okay, conversely, hyperadrenal function is usually associated with insulin resistance, and these are the people again that fatigue after meals, and usually they have no problems falling asleep, but they have problems staying asleep. And so, again, their energy levels tend to crash around 3 or 4 in the afternoon, and then it might pick up some again in the early evenings, and then, then it just crashes, and then you're just ready for bed. But since your blood sugar is not stable all day long, you might have a problem staying asleep all night long. So that's an issue, okay? Another issue with this, and this is something that's really underrated when it comes to treating a person, is chronic daily stresses. And these daily stresses can be anything from work-related to family-related to relationship-related, and you really need to get a handle on these stresses and try to minimize or manage these stresses as much as possible, whether it be some type of art or meditation or biofeedback or music, dance, exercise, anything that you need to do to manage cortisol levels, you've got to do that, because chronic elevations of stress on a daily basis is the biggest kind of obstacle that will prevent you from healing, other than obviously the anemia that we've already talked about. Okay. As far as the thyroid is concerned, now the most common patient that I see in terms of autoimmunity is your Hashimoto's patient, which is a hypothyroid condition. But there's actually 24 different thyroid patterns that you can have, and you really have to address and be able to diagnose which thyroid pattern that you have to really address what's going on with the thyroid. Now, the thing is when you find out what particular thyroid pattern that you have, more than likely it's going to fix all of these other issues with respect to the gut or the brain, the white blood cells or the red blood cells, the blood sugar, the adrenals. All of this is basically kind of combining to fit the pattern of which one you are particular in this 24 pattern type of thyroid issue or thyroid condition that you might have. So it's very important that you kind of dissect what's going on with your thyroid and figure out, number one, what thyroid medication you need to be on, and number two, your appropriate dose. Otherwise, if you can't get those right, then again, you're going to be playing catch up, because every single cell in your body needs that thyroid hormone, and without that thyroid hormone, the cells just fail and they don't function properly. Okay, liver and biotransformation. The liver is your main detoxification organ, and without proper detoxification mechanisms, then toxins build up in your body and can create a massive source of inflammation, and then again fuel up this autoimmune issue that you might have. Okay, so one of the things that we need to look at is what's called MTHFR and homocysteine. We also have to look at what's called MTTR and maybe COMT. These are genetic variances that may prevent you from methylating properly, and if you can't methylate properly, then your homocysteine levels rise. And homocysteine, again, is another one of those markers that can cause accelerated brain degeneration and accelerate the brain fog, accelerate the chronic fatigue syndromes, and accelerate the mood swings. Okay, so we definitely need to keep your homocysteine levels in check. Glutathione is one of those, probably one of the most important antioxidants that we have in our body, and this antioxidant protects the mitochondria, which helps us to create more energy in creating that glucose, which is the blood sugar, into energy. So if you don't have glutathione, again, you're going to result in chronic fatigue and the brain fog and the depression because you just simply don't have the energy to run the the pumps or the DNA synthesis or all the mechanisms that your body needs to basically synthesize and develop proteins, enzymes, hormones, neurotransmitters, etc. Okay, so very important that we address glutathione levels. Sex hormones. Now, with sex hormones, we have to look at imbalances in sex hormones, and some of the things that can cause this, or probably the most common underlying cause of sex hormones, is actually blood sugar. Okay, because if you have chronic elevations of insulin, that's going to create, in men, that testosterone gets converted into estrogen, and in women, the estrogens get converted into testosterone. So again, in order to really balance out your hormones and to address hormones properly, we really have to look at the underlying mechanisms, which is usually related to blood sugar. Okay, DHEA and pregnenolone, these are hormones that are synthesized by the adrenals, and with these are usually the precursors to estrogen, cortisol, and progesterone and testosterone. And again, if your adrenals aren't working properly, then these hormones may be lacking, and therefore your sex hormones are not going to be functioning properly. Okay, so again, it's just reiterating again that everything is kind of connected, and you really need to address everything to make sure that the proper physiology in the body is going the way that it should. Okay, as far as the immune system is concerned, there's other things that we need to look at. We need to look at environmental toxins. This could be anything from, mercury in your teeth or in your amalgams. So you might have to get that removed. We might have to look at previous infections such as Epstein-Barr, cytomegalovirus, Lyme disease, and we need to, if we need to get a medical doctor on board to write us prescriptions, then that's what we need to do to really address what's going on in the immune system. Otherwise, these things can be a source of inflammation, again, that can activate your autoimmune issue. Okay. Then, obviously, as I talked about in previous videos, we have to address Th1 and Th2. Certain foods can address or stimulate your Th2 or Th1 side of your immune system, and certain foods can stimulate the Th2 side. Okay, so you have to kind of look at that, and to get a little bit more in-depth information with this, you might want to look at that video that I have concerning Th1 and Th2. Then we also have to look at what's called Th3 and Th17 pathways. Now, what these do is actually the Th3 pathway actually is dependent on vitamin D levels and glutathione and probiotics, and they help to regulate or balance out this Th1, Th2 mechanism. So, if you have an improper, or if you don't have enough of those, if you don't have enough vitamin D levels, or probiotic, your probiotic levels are low, or you just don't have the variability in the probiotics, or your glutathione levels are low, it's not going to be able to stimulate these Th3 cells, which are T regulatory cells, to help balance these out. Okay, and therefore your autoimmunity runs amok, and again, you get the symptoms that you do. Th17 is an inflammatory pathway, and it's related to what's called nitric oxide. Okay, now there's three types of nitric oxide. There's inducible, which it's the bad one, it's pro-inflammatory, and then there's two that are good. There's the endothelial, and there's a neuronal nitric oxide synthase. Now, those are good things, and those things basically help to decrease inflammation, and they also increase vasodilation. Okay, so that means that there's improved blood flow to the brain, there's improved blood flow to the extremities, so it does help with cold hands and feet, and even with hair growth, and obviously it helps with sex organs or sexual dysfunctions. Okay, because of the increase in blood flow and dilation, some of my patients have felt that they no longer need their Viagra to basically help them with their erections, because this nitric oxide synthase is actually being helpful in order to get to improve their blood flow. Okay, and same thing with women. Some women say that they have experienced better sensations and decrease in sexual functions or dysfunctions, I'm sorry. So again, it's all kind of related to blood flow and these nitric oxide synthase pathways, and that needs to be addressed in the immune system to have an effect on all of these systems. Okay, so again, kind of, this obviously is not the end all be all. Okay, there's lots more things that we can fit into this, but I just kind of wanted to explain what I do when I see a patient and what we need to look for in terms of the metabolic conditions to really get to the underlying causes of their issues to really improve, their quality of life. Okay, there's really no way to turn off an autoimmune gene once it's already occurred, but there are ways to modulate it and to dampen the symptoms, and that's basically everything that I just talked about here. Now, the good part is we have bio lab markers to look at every single one of these things, and we have supplements that can address all of these protocols as well. It just depends on, what you need to do or what we need to focus on first, to basically start addressing and to put you on the proper protocol or supplemental protocol to start addressing your symptoms. Okay? That's all I have. But I wanted to also put up my contact information. So the website is sdbraincenter.com. I also have a blog at askdrgeronimo.com. You can access that on the website. This is the email address if you have any questions. It's info@sdbraincenter.com. And the store where we can get our supplements is shop.fecsd.com. My name is Rommel Geronimo. I am a functional neurologist. I'm a board-certified chiropractic neurologist, and I wanted to create this video to help people understand that there are things that we can do for people who suffer from autoimmune diseases. It's not just about steroids. It's not just about antihistamines. If we can really dig deep and look at all these different mechanisms here that can really affect how your body functions, we can improve your quality of life. All right, take care and have a great 2016 and beyond. Bye-bye.